We're going to first start here, as you see, with injectable collagen. Now, what's important is we're using Cosmoderm as a form of injectable collagen here because Cosmoderm doesn't require a skin test and doesn't have any allergenicity. The most important thing that you understand as you begin is you start at the side and you inject centrally. And you go very slowly. Now what you do is you put the needle in initially, just like I'm doing, is I stretch the skin with my opposing hand. You drop the needle into the potential space on the mucosal side at a 45-degree angle. And then what you do is you drop the needle then back to approximately, maybe it's a 5-degree angle. Now this is the most important injection of the whole mouth. Here I'm injecting the potential space from the lower lip going up to the upper lip. And you'll see me doing this again and again. And then I inject along the border of the potential space. But rather than injecting it above on the skin side of the potential space, I'm injecting it on the mucosal side. So actually it doesn't become visible. The most important thing of doing anything cosmetic in the way of enhancement is it must be undetectable. Because once you can detect something you've done, it doesn't look right. So here we do the lower half of the right lip and the upper half of the right lip from that side. That was with Cosmoderm, and now we're going to do it with Cosmoplast. And again, we stretch it with the hand of the opposing and the first and second fingers, and then we drop the needle in right at the end of the lip, because part of the end of the lip initially was inside our mouth because it lost support. And then we're going into that potential space, and you flow the material ever so gently. And there you can see the little scar right there. See that scar? That scar you're going past was a result of the auto accent. So we're going to put some Cosmoplast right into that scar on the outside, and then we also go on into the lip, and we go to the center of the lip. What's important is also you want to produce pout. Now watch me go up this little potential space. I drop into it, and I lift up the corner of the mouth by dropping into that potential space, pulling that space with the opposing hand, and gently making the needle flow. And what you want to do is feel the needle flow. Once you run into resistance, you will remove the needle and you gently insert the needle. And remember, what is very important is that your insertion must be as gentle as your removal. Now what we're doing is we're going to build up the lower third of the face by building flying buttresses up from the chin. And these flying buttresses are going to re-support the lower third of the face because as we get older, we're lost with this support of the face. And what happens is the upper lip gets farther away from the nose, and the lower lip goes close to the chin, so that there's a flatness to the face, and also because the nose begins to look bigger with that. So here we go, filling in the lost volume, the lower third of the face with Cosmoplast here, and you're going to see me do it in a serial puncture manner. Now, I'm showing this video here to show you how I use Cosmoplast and Cosmoderm filed by Restylane. But I could use Restylane as a product by and large by itself to do that. And there we build that whole flying buttress from the chin border. Because what you want to do is restore the angle of the chin to restore the manner in which she looks. And there you are lifting up the corner of the mouth. But what's important is to pull everything centrally. Now remember this, facelifts by and large pull everything laterally. Here you're pushing everything centrally, and that's where you're going to pull up the redundant skin, and it won't look artificial as if the person is running into a wind tunnel. And here I went up the nasolabial fold right there, as you saw me do it, in a serial puncture manner, gently inserting the needle, injecting it very slowly in the mid-dermal space, and there I go over putting Cosmoplast over that dent in her chin. Again, building up her chin so that you will see that I will re-support the lower third of her face. Now here we go back into that little scar, because the scar is going to become increasingly notable once she's had this done. And watch me fill that potential space right there in that scar with Cosmoplast. Now here comes Restylane. Now the nice part of what I've done is she's numbed those areas. And I can stretch out and make the Restylane flow with a 30-gauge needle. You'll see I make it flow in the lip. Now, I don't get bruising with it. I don't get angioedema with it because I go very slowly. I stretch it with the opposing hand because this material is much more viscous, this hyaluronic acid, than the collagen product, so it doesn't have the same flow characteristics, but you don't want to use force. Now, in most of the studies, when they used the retrograde injection, where they pulled it out or thread the needle, it didn't last as long, nor did they get a little bit of bruising that I don't get. Now watch me go up to the corner. Watch me lift up the corner of the mouth by injecting the potential space of the mucosal side from the lower lip to the upper lip. And then I go along in a serial puncture manner. But what I do is I flow the material in that potential space of the mucosal side of the vermilion border, and I flow it right up into the middle of the lip. And you go slowly. I mean, sometimes I can spend up to an hour and a half injecting a patient. The other important thing is to have a nurse in front of me watching what I'm doing, because what you want to produce is symmetry. The other thing additionally that you want to do is you want to make sure that the lips look natural when they move. Now I'm going to build up my flying buttresses, again, injecting by pulling with the opposing hand, getting a firm surface to inject against, and injecting up the material in a serial puncture manner in the mid-dermis. Now there you see me do it, and you can see there's very, very little bruising. So what's important is you don't want to produce bruising in the patient, and you also don't want to produce any pain. And by doing this very slowly, and not in the 10-minute time span that some patients or some individuals attempt to do it in, you will not have the problems that can be associated with this. So when I initially saw all the reports of bruising and lumpiness and swelling reported with this that were thought of as adverse reactions, I realized it was because of faulty technique. They were forcibly injecting it. And again, I'm pulling down, building up my flying buttress, pulling the skin in to get rid of the redundant skin instead of pushing it back, because you don't want redundancy. And then you build up slowly the flying buttress up to the lower lip to re-support the lower third of the face. Now what you're going to see me do is go up to the lip, and then I'm going to pull the skin. Remember, see how much I pull the skin? And then what you're going to do is go up the nasolabial fold. But again, look how medial I am, or towards the inner surface or inside I am, because you don't want to contribute to the cheek. Because some people often inject this material laterally, creating a ridge up there. So what you want to do is you want to feather the border of the nasolabial fold with the hyaluronic acid. And basically why this doesn't hurt whatsoever is because I'm injecting it at a place where I've obviously inject Cosmoderm, which and Cosmoplasty, which has made it numb. Now what we're doing here is we're using a 32 gauge needle with Restylane. And to me, the viscosity, once it passes through the 32 gauge needle, is unchanged. So I don't think I'm shearing the product. But even if I was shearing it slightly, it would work. But look at how I got rid of that scar lip by stretching and injecting that scar with Restylane, just as you see me do it. So we got rid of the scar lip. Now we're going to do that whole dent across her chin. And we inject it as pulling and injecting this right under the skin, utilizing a 32 gauge needle. So I find the application of the 32 gauge needle is wonderful for fine lines, and what this does is it makes sure some of the hyaluronic acid particles down, but even if it doesn't cause any inflammation. And she had essentially no bruising. You'll see her after pictures after I get done doing this. So I'm getting rid of that dent over her chin and getting rid of that little scar to her right lower lip. And so that's what you're doing, and you're also injecting it all materially, because remember this, being pulled and made tight is not youthful. Youthful is about volume, and here we go, returning the volume to the most important thing, the lower third of the face. I constantly have my nurse looking in front of me and using a xenon arc light. The other thing I use is high magnification as I do this. And as you can see, as I'm using the very, very fine needle to make sure that I re-support everything in this place. And now I can be using a little Cosmoderm to touch it up. And now I'm going up with the Cosmoderm on top of everything, just touching up any little spaces with the Cosmoderm with the 32 gauge needle. But remember that I could also do this with Restylane with the 32 gauge needle. So I can mix and match these.